Hi, everyone. Thank you so much for everyone who just called that to my attention, especially James. I am so sorry. It looks like I had started the broadcast and I actually did not. So thank you for dropping that note in. I am just going to roll with this. I am so sorry. Thank you all genuinely for your patience. Panel members, thank you for rolling with the punches today. My goodness, is there a full moon? Can I blame this on the eclipse?
Exactly.
There's an eclipse coming, right?
It's ALS humor.
Good grief. Okay, let's do an abbreviated intro here, everybody. Welcome to the ALS Learning Series for the Les Turner ALS Foundation. It is March, Thursday, the 28th. We are talking about multidisciplinary care. I am Anne-Marie Doyle. I'm the Community Education Manager here at the Les Turner ALS Foundation, and my cheeks are getting rosier by the minute here. I have some very special panelists that I want to introduce you all to, and then we'll just kind of jump right back in. Everybody who has joined, you are off camera, you are muted. Some of you have figured out the chat or the question feature. Please continue to drop any questions in there. We should have time at the end to go over any questions that may come up. If anybody has a question and we don't get to it, I can still see these, so I will send you an email. If I can't answer the question, I will find somebody who can for you. All right, so on today's panel, we have Chanel Cavers-Perkins. She helped with the process of this panel today. Unfortunately, she wasn't able to make it. Janie Govelli is a clinical research ambassador through NEALS. She also is on some patient advisory boards and is a person living with ALS and attends a multidisciplinary care clinic. And Frank Granata is on our board at the Les Turner ALS Foundation. He is also on a offshoot of our board, our support services committee. He is a person living with ALS and also attends a multidisciplinary clinic. April Szymanski is a nurse practitioner at our Les Turner ALS Center at Northwestern Medicine. And Lauren Webb works for the foundation as well. She is our Chief Advocacy Officer. Welcome, everybody. All right, take two. Janie and Frank, let's talk a little bit about multidisciplinary care and how it has impacted you and your family. If anybody wants to take that first.
I'll go first. So how it's helped me is I had an issue of how to get into my home because of multi-stairs, and the nice part about the multidisciplinary clinic is they were help me problem solving, and they were able to refer me to be able to get a lift outside my home so that I can get in through the back sliding glass door, which is important to be able to get into my home. And then as my ALS has progressed, I was having trouble getting in and out of the bathtub to take a shower, and they worked through that with me to get a roll-in shower. So that was very beneficial, and helping me with nutrition, like that. So like my husband or whoever's with me, we're on the same page, knowing about my caloric count, knowing that I'm getting the right amount of calories, and what's like the best nutrition and supplements and things like that.
Yeah, and mine's right along with what Janie was saying, but especially when you have family there with you, they're hearing everything from all the individual disciplines that you meet with throughout the day. And again, I can't stress this enough, but there's whether the feeling is very genuine when they're treating you, when they're listening to you, and all the information is shared with all the different team members. So you're never No one's walking in blind, another new doctor that doesn't really know. You're having to explain everything all over. They already know you before they come into the room. They know as much about you as they can get from the other doctors, so they have an idea of where to start. And that saves a lot of time, and it also helps build a rapport. It's almost like you're meeting a friend of a friend that's helping you get through a journey. I find having the clinic all in one day, although it's a long day, it ensures that everyone is on the same page. The group that came with you, everyone's hearing the same thing from the same doctors. You have your note taker, because it's not going to be me. And then not if you had any notes you can read. But we walk out of there and the family knows what our plan is, at least until the next visit, and what to watch for. And that's a unique experience for me. I've had other medical things over the years. I've never had an experience that is done as well as this clinic does. I'm not saying that just because I joined the board. I did that because I wanted to give something back, but it works. It's helped me tremendously. It's helped my family. It's helped other people outside of my family get a better understanding of ALS, which has helped me. That helped to explain it all to them, because I know I'll miss something. But it's just, it's again a unique experience that truly works, and it's focused on your well-being.
And your individual needs as well.
Yeah.
Yeah, so there's kind of two, maybe three things that I kind of want to touch a little bit more on. One was that collaboration piece. So maybe April, can you talk a little bit more from like a provider's point of view of what that collaboration looks like and how that can be beneficial? And then Lauren, I have a question for you.
Yeah, so we collaborate as a team. As Frank and Janie had mentioned, we have multiple kind of subspecialists on our team, from the neurologist, the pulmonologist, dietitian, OT, PT, speech, and research coordinators. So communicating with a bunch of people through clinic can be challenging, but we have a communication board that we use. We keep track of where people are, who needs to see who, and who's already seen who. And, you know, my job as the clinician is to kind of see the patient first, kind of understand what's going on, what are their needs for that day, what are they looking for, what are their goals of care, and then communicating that to the other team members. We rely heavily on our nurses, because as all these different people are visiting with the patient, they're then reporting their care plan to the nurse. So the nurse is the one who kind of wraps it all up for the patient at the end and kind of, you know, centralizes that care plan for the patient moving forward. But it's constant talking. You guys kind of mentioned a well-oiled machine. We might call it organized chaos on our end, but
I said well-oiled.
Yeah, that kind of, I love that idea of organized chaos, well-oiled machine. Lauren, my question for you that was kind of touched on, with all of this talk about having these different specialists, having kind of one place where you can kind of get all your answers covered. Can you speak a little bit more about the benefits of multidisciplinary care from like health outcomes for people living with ALS?
Yeah, so, you know, studies have shown that multidisciplinary care improves and extends life expectancy. So, you know, people who attend multidisciplinary care are having their needs addressed and giving the tools to address their own needs at home. And I think that really helps, you know, with the health outcomes. And then the other really important factor is also the quality of life. right? So, Janie was talking about the lift outside her back, right? And having those very specific things. I mean, having a specific, piece of equipment to be able to help, get out of the house easily is really important. And multidisciplinary care is recommended by the American Academy of Neurology, and there are quality measures associated with that. And again, it's the standard of care across the country. And that's something that's really important when you're choosing your care team is finding out what team works best for you and your individual needs. There are many clinics across the country providing care, and we happen to fund a clinic at Northwestern.
I think that also kind of makes sense. And Janie or Frank, I can't remember which one of you had kind of mentioned this, but I know we've all gone to doctors before, and having to tell your story over and over and over and over and over again can be really frustrating. So I can see the benefit of attending a multidisciplinary clinic where maybe you have to tell your story once and then everybody's kind of up to speed. And really all you're doing is filling in those missing pieces or things that are different or things that have changed. So it's not like you're meeting a new person every single time you go to the doctor, and then you have to get them all up to speed on every medication that you're taking, every supplement that you might be taking. All of that definitely, I could see that definitely being a benefit. Kind of building off of that communication piece, I know at our clinic, and April, I can't remember if you mentioned this or not, but there's something called My Chart. So you can communicate with doctors through My Chart. At other clinics, it may be a different type of electronic messaging system. Janie or Frank, have you noticed kind of the best way to communicate with doctors? Is it the day of clinic? Is it using an e-messaging system? Is it calling clinic? Like, any advice from that point of view?
Well, definitely the day of your clinic, that's very important because you have your questions prepared before you go, and then you might think of something or follow up. And I use that portal often to communicate, and they're awesome in like responding to whatever your question is, or referral, or what it may be. And I feel like it's a valuable tool. Calling, I don't do as much, as often, because it's like, 2-day response, I think, or something like that. So I feel like it's more immediate, and I can do it anytime. And, I could do it at 2 in the morning if I wanted to. And, when things pop in my head, I forgot, I got to ask about this. So I feel it's very beneficial to use the messaging system through our clinic.
That's a really good point. I didn't think about the time piece of, like, I'm sure we've all woken up in the middle of the night being like, I forgot to ask XYZ. Yeah. Frank, sorry, didn't mean to cut you off.
No, I agree. Between the portal and the day visits, those work in tandem and keeping you connected with the people at the center. But there's also I have a social services call once a month with Rochelle, and it's just her and I, and we just talk about everything. But it also, where I may not be immediately identifying a need, or it's evolved since my last visit, she may be able to hook me up with another customer service group. Right now I'm working with the Bridging Voices, or the technology piece that you may use them too, but I'm losing a lot of the ability to use a computer and phone effectively, for lack of a better term. So picked up on that right away. Physical therapy over at Shirley Ryan had a place out here. There's always someone to connect you with. Live Like Lou, they help me find them, and they help me with some things around here. It just, again, it goes back to like the one-stop shop, but it just never stops. It's just, there's always, the more information you can provide, the more help you're going to get. You just need to be honest with yourself about what you can and can't do. Sometimes that's not easy to do.
Mhm. And what's
Yeah.
I'm sorry, I mean, I didn't mean to. What's nice about clinic as well is, I'm no longer able to drive, and so that impacted my outpatient physical and occupational therapy. So now I am receiving at-home therapy, which has made a huge difference for me, in that I don't have to, worry about transportation and things like that. So that all evolved through the clinic, being through multidisciplinary care. So it's very important.
Frank mentioned our support services team. So some clinics may have a social worker or a nurse or a counselor that may be affiliated with another ALS advocacy organization. So for example, our clinic at Northwestern, our support services team is part of that multidisciplinary care. And Frank talked a little bit about Rochelle and how she has positively impacted his journey. Janie, do you want to talk a little bit about your support services coordinator?
Absolutely. Karen Steffens is my social coordinator, and we do meet in between clinic visits. And she's got all the notes. She's all prepared. She's another great resource. I'll be like, oh, I need a new shower chair or something. She'll get the resources to me right away. We do also have a monthly support group, which is awesome. We have a great group, and we've become so close in that we've got that the gala coming, caring for hope, that we're all want to plan to sit together, because we've never met in person. We've all just met over the computer. So we're looking forward to that, so that we can actually be together in person.
Thank you so much for reminding me about that support piece as well. So you joined one of our virtual support groups. If anybody else on the call is looking to have that sort of support, feel free to visit our website. I can put it in the chat, but all of our support groups are virtual. So and free to join. So I can drop that link if anybody is interested in that. So you both have kind of mentioned this technology piece. April, I might throw it back to you. Living in this kind of post-pandemic, if we're allowed to say that, or if that's the right term, endemic, part of time right now, how has technology been able to be utilized in a multidisciplinary clinic?
Yeah, I think the biggest component at this point has been our use of telehealth, which we actually were sort of on board to bring on, but we kind of just was baptism by fire after the pandemic hit. We kind of just were forced right into it. But it really has helped us stay in better touch with our patients. And we've talked a little bit about how the visit itself can be a long visit, and especially the first couple visits when the diagnosis is newly made, or the patient and their family are still kind of navigating through it. And so despite the fact that we may have all the resources at one visit, you might not always absorb all the information that's given to you. So with telehealth now, we can follow patients closer. We do a closer follow-up visit after the first visit, usually with myself over telehealth, to check in, see how things are going. There's medications that are available that are unfamiliar to the patients and their families. So we spend a lot of time talking about the medication options, symptom management, and then maybe provide any additional resources with any of the other team members or support services that maybe just didn't have time for at that first visit. So that telehealth has really allowed us to stay, I think, in better communication and really enhance that early intervention part that's so important for our patients. And we can also do some at-home respiratory assessment too for patients, because we do know that early intervention with non-invasive ventilation is very important too for prognosis and quality of life. So just having that telehealth, I think, has really made a huge impact on our ability to continue to provide the multidisciplinary care without the patient having to make the full commitment of coming into the clinic and spending 2-3 hours and finding someone to come with them for that time as well. So I would say that telehealth has really probably been the biggest transition from in this post-pandemic state.
And we saw this with our support services. So we had a huge increase in our frequency of working with families. We're over 4,000 engagements last year, and we really work with families all throughout the journey in between their clinic appointments and helping, to problem solve and helping to brainstorm and just being an ear, just being there to listen and support families, on that journey. And we found, telehealth and expanding our online educational opportunities has really been a big benefit. So people all across the country are now aware of some of our educational resources that we have that we didn't have until we started really working on that. So I encourage folks to take a look at some of those educational materials, because I think it's really helpful when you're working with the different multidisciplinary providers to have those conversations, to talk about, how do I improve my sleeping? What does it look like? What does this mean for me? And to help generate some of those ideas. So when you are in multidisciplinary clinic, you can ask some of those very particular questions and then have a plan that's tailored to you specifically.
That's a really, really good point, Lauren. Again, I just want to emphasize kind of this theme that I'm hearing from all of you, that although it's one-stop shopping, right? And you mentioned these terms like well-oiled machine. It does sound like it is very, very individualized for each person that attends. Whether that's like April had mentioned, getting started on specific treatments like non-invasive ventilation, or like Janie had mentioned, somebody providing you the information on how to get a lift so you can get in and out of the house safely. One thing I don't think we've touched on just yet is the clinical research or clinical trial opportunities. Jeannie, do you maybe want to talk about that, just because I know you're involved in some patient advisory boards and things like that?
Absolutely. So actually the day that I was, diagnosed, I said I want it all, I want to do genetic testing, I want to, do clinical trials. My second appointment, actually Emily came in and, we discussed about, clinical trials and what's available and, how does it run, and, if I was interested. And I'm like, absolutely. So I'm actually, it'll be a year, no, it was a year in June that I've been on my clinical trial meds, and we're extending it another, or they are extending it another year. And the beauty of it is that it's right, it was at once a month in the beginning to to go to clinic to have blood work and physical and things like that. But now, because I'm on the extended phase, I go every 3 months, so we tie that into my clinic day, which, I value that. And then, Dr. Driss is my doctor, and April. And so, we're all on the same page. And I think I've said this before, when I leave clinic, I feel that, I've gotten so much information, next steps, things that, they suggested or they're going to follow up on. I feel like my toolbox is full by the time I leave, clinic, because, I may know some information about ALS. I've researched it a lot, but you don't know until you're living it what might transpire and what it might look like, the next stages or whatever it might be.
Oh, I love that idea. I love that visual of a full toolbox that you're leaving clinic with. And I think you also bring up a good point of sometimes those clinical trial visits could be tacked on to your clinic visit. So again, that may extend your time in clinic, but having the opportunity of not having to make multiple visits sounds like was really beneficial for you.
And I recruit different friends and family members. I think Frank was saying, so that they can get a taste of what my experience is, because a typical appointment would go to their primary doctor, it's one doctor visit and they leave, and then friends and family are just amazed at all the different specialists that come in, and they're like, wow. I mean, they're amazed too, so they get to see secondhand what I experience, and
It provides them a higher level of comfort. Don't you agree?
I agree. And they can ask questions too,
Absolutely.
which is amazing that they can do that right then and there.
Yeah, we hear all the time from caregivers and family members who, really look forward to going to clinic to be able to get some of the questions answered and problem solve, whether it's for their own back or, wanting to ask and answer, questions ahead of time. That's been really, really helpful. And, with the clinical trial piece is being able to let your clinician know if you are interested in a particular trial. You can always shoot them a note in my chart to have a more in-depth conversation about it as well. So there's just so many different ways to talk with your multidisciplinary team about your individual care needs, and for your loved ones to also be able to ask those questions.
Mm-hmm.
Wow, everybody, I'm looking at the time. I want to be mindful of everybody's time. We have about 5 minutes left. Any last thoughts that you'd like to share with the audience about multidisciplinary care? I'm going through, it doesn't look like there's any questions in the chat currently.
I guess my wish is that, anybody, everybody that has ALS, that they have the same opportunity that we have, because it is such a phenomenal experience and caregiving for us.
And I completely agree with that. Again, I've had several health things over the years. This is the one time where I truly feel that it's completely welcoming. Every issue that I could possibly be thinking of, they're thinking ahead of it, and they're genuinely concerned about how I'm progressing and what I can do to get ahead of the curve. And that for ALS, that's critical.
I agree, and especially like with the breathing. I know we're trying to get ahead of the game just in case, and I know we've done that with sleep study, at-home sleep studies and things like that. And I know my next clinical day, we're going to include the pulmonologist because I haven't seen him in over a year, just to go over maybe concerns or the next steps for myself.
And thank you so much for sharing that, Janie and Frank. And Lauren, I'm going to shoot it over to you while I drop a link in the chat for folks about the ALS Better Care Act.
So, we've talked a lot about the benefits of multidisciplinary care and how it's the recommended standard of care and leads to the best possible outcomes. But one of the challenges is that multidisciplinary care is very expensive to administer. When we think about all of the providers who are actually involved in care, oftentimes the neurology budget is completely blown, and they are reliant upon charity care to make up for it. So at the Les Turner ALS Foundation, we help fund the clinic at Northwestern. And as well as across the country, that's the case. You know, I've heard stories of neurologists who are running their own bake sales and, you know, running different things. Everyone is trying to put these dollars in place so that they can hire and have a really strong multidisciplinary care to deal with and to help people have that genuine experience that Frank was talking about, right? Having that stable clinic team to be able to provide support you know, for the families is critical. You know, you're relying upon teamwork and really engaged professionals who care about ALS to do this work. But the problem is that there isn't enough funding. And so we are looking to the ALS Better Care Act to help provide a supplemental payment for Medicare to be able to allow for expanded multidisciplinary clinics at certain locations that might not have the full multidisciplinary suite because they don't have the funds. It frees up the resources for the clinics to be able to focus on delivering better high quality care, so making those individual adjustments, as well as, you know, when you have a clinic that's so heavily resourced and providing care that Medicare should be covering, you're losing some resources that could be allocated towards clinical trials, more broader participation. So all this being said, I really encourage you to raise your voice in support of the ALS Better Care Act through MDA's Action Center. So Anne-Marie can drop the link in the chat if she hasn't done so already. It really help us. We're really trying to get as many people to co-sponsor this bill as possible to be able to make meaningful change so that care is real across the country and that everyone feels the support that you know, was conveyed today, and really that can only come with sustained funding for these clinics. And I think that's all I have. Oh, it looks like it didn't go through. Oh, that's okay.
Oh, yeah, everybody, we'll make sure to have the full link on the website, on our website, when you go to rewatch this, and I can also email it out as well.
That would be great,
to everybody. Yep. And then William and Teresa, I saw you had some questions. I will email you personally today with the links that you're looking for. And then Dawn, looks like you had a question about how long Janie and Frank had been diagnosed with ALS. Janie and Frank, are you comfortable sharing that?
I noticed my first symptoms of January 2020. I was diagnosed in December of 2021.
I was diagnosed in October of 2020. So I have a slower progressing ALS, mostly upper body, but it's going on its tour. That's just what it does.
And I'm wheelchair bound at this point. I was average progressing. I think I still am, but it's now going into my, you know, my arms and my shoulders.
Thanks for sharing that. And so everybody, we'll be wrapping up for today. Before you all go, I just want to let you know that on Monday, April 15th, we'll be having our April Learning Series on advanced directives. So Dr. Coleman, who is a pulmonologist in our clinic, and Julia Lay Bellarte, who's an advanced care practitioner in our palliative care at Northwestern, will be talking about advanced directives. So what they are, the benefits of them, how to have some of those really tough conversations. So we look forward to you joining us in April. That link should be up on our website once we get this webinar taken care of. You'll find the link to register on our website later today. All right, everyone, again, thank you all for your patience today. Thank you all for letting me know about the technical difficulties. And thank you to our panelists, Janie, Frank, April, and Lauren. I really, really appreciate you sharing your stories and being so comfortable with talking about multidisciplinary care today. We'll see everybody in April. Have a good one.
Take care.
Take
Bye.
care.
Everyone.